Hey, Dr. Brandon here, owner of Physio Biomechanics, and today we're going to learn how to use our foam roller to start to ease tight and tender muscles on the back side of the hips, specifically the glutes and another muscle called your piriformis. Now, these muscles generally tend to get tight and tender either A, from just being overworked, so maybe you did step ups, maybe you did lunges, maybe you did squats, and you're wanting to help them recover a little bit more quickly. Maybe you've been stretching your hips out and with really no improvement. You stretch them out, they get tighter again. You stretch them out, they get tighter again. And more often than not, there's a few places on the backside of those hips where you're noticing a bit more tightness or tenderness. And so this video will just teach you how to use your foam roller to start to iron those out. All right, here we go. So, what's going on when we're foam rolling? First thing that we want to talk about is that what we're actually not doing, and that is we're not really breaking up anything. Okay, so we're not breaking up fascia, we're not breaking up scar tissue, we're not manipulating the joint, we're not, so really none of that. Really, what we're doing with our foam roller, and this is why we don't have to use a lot of extra pressure on it, at least from the start, is we're actually really working on getting your nervous system to calm down. So a lot of times those tight, tender areas are tight and tender because our alarm system, our nervous system has told them to be so. So that is the main reason why when we're doing the foam roller, when we're talking about how to use it, we don't really have to smash the snot out of it. We really can focus on working slowly into it. And so it doesn't necessarily have to be painful. For our foam roller, it does not necessarily have to be something that's hollow with ridges. Really, any type of foam roller will do. If you do happen to have one that's really soft, and you notice it's just kind of been broken in pretty good, you may want to go ahead and get a new one. But other than that, the type of foam roller doesn't really matter. So here we go. So for our foam roller, we want to go ahead and place it perpendicular to our body. We want to go ahead and come up onto the foam roller, and first off we're going to scan with our legs straight. So in this case I'm going to pick my hips up. We're taking care of my left hip. I want to gauge my pressure with this leg and with both hands, and basically I want to be just enough that I know that I'm on any sort of spot. And so basically I want to go ahead and scan the glutes, find where I'm having any issues. And if I do happen to find an issue, I can go ahead and stop on it, focus on breathing into the pressure, as the pressure releases the muscle, sinking a little bit further into it. My second position that I want to have for that left glute, specifically those left rotators of my hip, is going ahead and bringing my leg up and across, and make sure that I have, again, that pressure from the bump on the outside of my hip all the way towards my tailbone. And again, I can scan through there, find those spots. I can either do small passes over the spot, or again, do more of an acupressure release onto that trigger point. All right, so about 2 to 3 minutes is usually enough to take care of any spot. Again, we don't have to smash it. We don't have to put a whole ton of extra pressure on it. We really just want to have enough pressure to find that we're on the right spot. And then again, 2 to 3 minutes, breathing nice and slow, making sure that you're not holding your breath through any of the pressure there, because tension in this case does equal pain. And so if you have any questions, post them in the comments below or direct messages here at Biomechanics. Again, I'm Dr. Brandon, owner and physio at Biomechanics. Where movement is medicine.